Hi everybody, I'm Chee Khei, and inside my group there's also Zelafy, and then Hisham, Jia Fu, and then I'm Chee Khei, and there's also Mo. And right now our project of C programming for the Arduino project proposal is actually called Go Shopping or Go Hospital. So why is it named like this? We are going to first start with all these contents. We are going to separate it into chapter 1 of the introduction, which include the project background, motivation, objective, and scope. And also we have the chapter 2, which have the project methodology, which includes all of those design. And then there's the project flowchart, task delegation. I'm going to tell you about our Gantt chart and milestones, and then the budgeting. So we are going to start with the project background of the chapter 1. So looking at the project background, actually we are trying to find something which can be more efficiently detecting the body temperature without near contact with people from the from such situation of COVID-19 right now, because we want to limit the spread of COVID-19. And then we want to find something which is more cost effective, because there are really limited paramedics right now, and then we want something which wouldn't cost much but we have the help of technology. And right now, if we are to include the current trends, we can see that there are a few right here: the Connix Health, and then the IQ Fever Check, and the iThermal by the iHaze. And these are actually those screens that are trending in shopping malls and some of the big companies, but then they are not in the small stores and shops and the offices right now. So we are going to move on and see like how is this trend going right now by the IQ Fever Check.
Continuing short supply.
Because the time is limited, so I'm not going to show you all, I'm going to show you this part of the technology.
If persons are detected with a fever, they can be tracked across multiple locations through a facility, even if they are wearing a mask, even when people are walking in large groups. The paramedic team is provided with each feverish person's image on the smartphone or tablet that they're using, and advised of their location. The thermal stations are unmanned and can operate 24/7. If a person with a fever is detected at any time, the paramedic team can be advised immediately and can take action. 24/7 continuous detection is important, as a person may only exhibit a fever later in the day. In a facility with many entrances, multiple thermal stations may be needed, but only a single paramedic team.
Okay, as you can see, the paramedic team can't go to each person 24/7 and detect them. So this screener will actually help them out. And we can see right here, I'm going to fast forward right here.
Managing their risk at a minimal cost.
Okay, so this is how it's going to minimize the risk, and then you can see how the expertise is being used, and it's actually very good. But then we can't see much in Malaysia yet, except for some of the shopping malls. So in the status quo right now, we want to quote that the cases of COVID-19 around the world have been increasing drastically, okay, since 2020 until now. Okay, since March we have been quarantined, but it's not being better. Okay, the COVID-19 outbreak in Malaysia is actually worsening as well, since we have so many of the MCO, CMCO, RMCO1, RMCO2. We have to reopen of public places, because we know that if we don't open the place, our economy is not stable, and then we will have financial crisis as well, so people have to go work. And then when we reopen the public places, people have to go out to buy the necessities and the groceries that they need. So it is unavoidable that they have to go to the other places to get the stuff. You may say that, oh, maybe we can have the delivery, but then there are many things that people enjoy picking themselves, and there are some certain fresh food that they want to get, like fresh groceries. And then you can see that some of those people as well, they don't like to be quarantined at home because it's very stressful, so they want to go out to have a meal, or they want to enjoy themselves. So the situation right now is not helping us, although we do social distancing, because the COVID-19 is spread through airborne. Okay, so you can see that everywhere you go, whenever somebody is breathing or sneezing, then you might catch COVID-19. So in this current situation, which is worsening, the status quo is actually telling us that it is very saddening, because when I'm filming this is 1st of January 2021, but yesterday we have 2,525 of the new cases. And you can see that this graph right here that we take from the JHU COVID-19 data, which is the world data, the cases are actually rising day by day, okay, up to here yesterday. So, and the Malaysian government is also telling us that we really need to perform social distancing strictly, but then we have to go back to school, we have to go work in order to keep our life moving on. So we want to tell people that we have to take more serious measurements, but then there are certain limitations to the existing thermometers that we see, because you can go to kopitiam or any of the grocery uh, selling markets, and then you can see that they have to still use the thermometer. Even the minus in UTM, they still have to use thermometer, and all the shopless there. So there's one thing which is very bad about the thermometer, is that you have to use another person's hand to actually detect you. So when the COVID-19 virus is airborne, you may actually breathe in that thing. Okay, this is very saddening. And then you can see that if there's no one who is actually measuring for you, if you have to measure it for yourself in certain shops that they put it there, it's even worse, because everybody has to touch the thing. And even if you wash your hand after a small period of time, you still have contact with the things which increase the risk of having COVID-19. So we want to prevent those contacts, we want to prevent those airborne situations. Uh, and then there is the third case, which some people might refuse to take the body temperature. Why? Because they feel like I'm keep on taking this body temperature and it's not necessary, or they feel so agitated when somebody have to take my temperature when I have been going in and out, okay, for several times, and I don't feel comfortable. They might say it, and I've seen situations like that, and we have nothing to do about it. So it is very problematic, and we think that we want to break through these limitations. So this one is an S curve that we have concluded. We quote them, so it's not plagiarism. We quote them. It's actually to learn the lesson of such serious case of COVID-19, that we could actually prevent the scenario with technology. So you can see that they have been proven that early surveillance, testing, contact tracing, strict quarantine, and technology could actually prevent the situation. And then in the most successful countries, they rely on the digital technology and integrate it in the policy and healthcare. Okay, so we can see that even China, when they have this worsened case, they have actually WeChat and CCTV, which help them to integrate this technology in knowing who has fever, and the paramedics, the limited paramedics, would just go to those people. Okay, and then our project objective, very obvious, that we are trying to detect the early fever symptom of anybody more conveniently and efficiently to avoid massive spread of COVID-19. Okay, and then the target user is actually everyone at certain places that you want to go. Okay, is to be specific, in front of shopping malls and grocery stores, and then in front of the offices and the staff rooms, and then in schools and universities, okay, and the airport, LRT station, bus station, okay, anywhere with crowds. And then there are the targeted technology, digital thermometers display, which include the LCD screen that you can see, and then the IR sensor, and also the buzzer. Okay, more about the technology, we will include it inside our report, which we will be crafting out soon together with the prototype. And then you can see right here the technology that we are trying to tell you. This is the screen, and then you have the camera right here. This is how it operates, and then you can see the LCD, which it will be telling you which situation you are in right now, your temperature. And then the project flowchart, you can see that we have meeting which we suggest ideal, and then we discuss online because of COVID-19, we can't meet each other, and then we see if it's good or bad. If it's not, we reject it. If it's good, then we elaborate it, and then we find details about it. Okay, and then the members split and we delegate work, and then we do reviews of the proposal. If it's okay, then we use it. If it's not, then we revise it and then we modify it, and then we submit the proposal to our doctor, and then we develop the project concept, and then develop the specifications, and then we do the design, and then we implement all those technology that we would want to have, and then we operate the project, and we end the project by showcasing it, and our proposal proposal right now, and also our report will be making then. And then the task delegation, you can see we made it online meeting. This is a proof of the picture, and then we do some discussion, and then you can see that I am in charge of public relations, presentations right now, and then compilation of slides, meeting secretary, and then paperwork, and then Tan Jia Fu is involved of the prototyping, the design and coding stuff, and then Zela is actually involved in the project background, flow chart, Gantt chart, and the progress, and then Hisham is in charge of the research and analysis, including motivation, objective, and project scope, and then Mo is in charge of the budgeting and financial management, which include all those profit margin and manpower and design and testing costs. And then me in task delegation of the report, that was the one of the proposal, and the report as well, I'm still the same, but for the report. And then Jia Fu is in charge of implementing and operating after designing, and then Zela is in charge of all those conclusions, goals checking, and milestone done as we plan out, and then Hisham is in charge of the functionality verification and the explanations involved, and then Mo is in charge of also the conclusion. And then you can see right here is the Gantt chart that I have been telling you just now, but we plot it out with our weeks and specific deadlines so that we will keep up on track. Okay, so this is the budgeting. So we have budgeted that Arduino R3 board is around 20 ringgit and 50 cents, and then temperature sensor 7 ringgit 50 cents, resistor around 50 cents, and then LCD display around 8 ringgit, and then IR sensor around 2 ringgit, and buzzer around 1 ringgit. So in total is 39 ringgit and 50 cents, but then we are not sure yet. This is just an estimation. So coming to an end, thank you very much for understanding us, and actually we have been looking forward to provide more value by having this product of ours. So in order to ensure that the whole thing will be running successfully, we have actually have all these plans in hand, so we will be keep on track about it, and then we would have more specific delegation in the future. So about all these temperature sensor and resistors, I suppose that the details of those things will also be included in our report soon, but for now all we can say is that we just want to implement all this technology inside, and the quantity that we use actually varies, and you can see resistor that we use would have 5 is actually because we don't want the thing to burn out. So whenever we have LCD or buzzer or temperature sensor, we will put the resistor in front of these things. Okay, so to ensure that there is a certain amount of the current that flows right through it. Okay, so that's the end of my presentation. Thank you very much for listening right here. Okay, bye bye.